most people, health information arrives through spoken words. But for some communities, these messages are never heard. In Lesotho, families living with hearing impairments often face barriers in accessing critical health information, including immunization services. Through the National Association of the Deaf, Lesotho, a different approach emerged, one that ensured every family could be reached.
I think NATIL and SDA helped very much because we were aware that there are deaf people who can go to the clinic because of communication barrier, but since we were there, they were able to go anytime. The chiefs and the village health worker helped us in collecting people because we didn't know which people should be helped by that time. I think the project should be in different districts, since the people are not only here in Marcelo. Since we recognize that they were not able to go for immunization here in Marcelo, we think it's even worse in some districts. The challenge was when we were going door to door, then some people couldn't answer us because they thought we were all deaf. Even though we showed them we have an interpreter, they were so surprised. That's the main challenge. The other challenge was that some places we would knock and there will be dogs. We can't even enter. So just because I'm deaf, I can't hear a dog barking. An interpreter should come and make me aware that there is a dog. To be fair, I know better on deaf people, so I think deaf people should be given interpreters, or interpreters should be placed at the facilities, because some can go because they don't get enough information. Some will go and they wouldn't be told to come back, so they can't read the booklets because they don't understand what's happening. So with the help of an interpreter, I think it will be very, very, very better.
The project introduced inclusive communication strategies. Information became empowerment.
The uniqueness of Maseru SDA working with the CSOs who can interpret, who are deaf, then can interpret the sign language, helped us a lot because us don't know the sign language, so we are able to also reach out to the parents and the mothers and the fathers who are not able to communicate with us because of the language barrier. Because of them being around, we were able to reach those, and then they were very excited because they normally complain that, when are you going to learn our language? When are you going to learn our language? For them, seeing those who can be able to communicate with them, they were very excited and promised to come back again to the facility, thinking that they are permanent employees. So I think it really did a good impact to us. I would like to thank Ministry of Health through the HMT for allowing CHAO to come and support us with this project, and also Gavi for providing the vaccination, the funding, so that the program could run smoothly. So my wish and my hope is that the program extends and expands to other facilities so that the country, Lesotho as a whole, can also be supported. So our children, our under fives, all throughout the country can all be reached so that they don't run short of vaccines or they don't get under-immunized.
I think we need the project to be there because some people need to be taught about immunization. Some people are too stubborn, and they say, because they don't understand. Truly, we thank God very much, because as a deaf person, we are not being hired out there, but we showed that we can work, we can be hired. and we got a very good support from SDA. So I think if ever the project continues, we will get a very good experience on this.
Sometimes the greatest impact comes from ensuring every voice is heard, even when words are not spoken. Through inclusion, dignity, and partnership, lives have been changed.